In this video, I will discuss phototherapy. Phototherapy for neonatal jaundice. If a newborn baby with jaundice requires treatment, then phototherapy is the first step. Here, the baby is kept under a blue light for the treatment of jaundice. And this blue light is not the usual blue light we see. It's a specific wavelength light for which separate machines are available. Newborn baby jaundice is very different from the jaundice of an adult person, and phototherapy is used for treatment of childhood jaundice only. How does it work? In newborn jaundice, the unconjugated type of bilirubin is increased in the body and deposited in tissues. After crossing a certain limit, it crosses the blood-brain barrier and gets deposited in certain parts of the brain, which will be manifested as symptoms like lethargy, irritability, feeding difficulty, abnormally high or low tone of muscles, convulsions, etc. The most important point is, if the jaundice is very high and not treated on time, it can lead to permanent brain damage, which can lead to developmental delay, tremors, abnormally high muscle tone, hearing loss, and sometimes visual abnormality. The blue light therapy converts the unconjugated bilirubin to a substance called lumirubin, which cannot reach the brain and gets out of the body through the urine, and thus the jaundice level falls. But in adult jaundice, usually the unconjugated bilirubin is not so high and the blood-brain barrier is quite mature. So the bilirubin cannot reach the brain and phototherapy is not of much help here. Once the baby is kept under phototherapy light, the skin color of the baby is changed transiently and it becomes difficult to assess the jaundice by looking at the skin. That's why, to assess the level of jaundice during phototherapy, a blood test is done. Usually, only 1 ml of blood is enough for that, and this test is done usually at an interval of 8, 12, or 24 hours, depending on multiple factors. For phototherapy treatment, the baby is kept under the blue light after removing the clothes. If light is given from above, it is single surface phototherapy, and if it is given from below, it is double surface phototherapy. To maintain the body temperature in normal range, the baby is kept under a radiant warmer. For feeding, the baby can be taken out for a short interval for breastfeeding and then kept back under the light. However, if spoon feeding or tube feeding is required, then feeding can be done while light therapy is ongoing. Most babies require 1 or 2 days of phototherapy, but some babies may need longer duration. After stopping the phototherapy, the bilirubin level may increase for a while, which can be checked as a rebound test after 12 to 24 hours. Lastly, according to the available research studies, sunlight exposure or keeping the baby under direct sunlight for treatment of jaundice is not beneficial and it may worsen the jaundice, especially by dehydration and delaying the actual treatment. Phototherapy is very safe and very effective mode of treatment.